The benefits that we would have, one of the things he would benefit from is exercising. Cardio brings a stronger cardiovascular system. Okay? But he can do some breathing exercises too for that. So 26 H?
Yes.
26? It's not bad. Now I take the resting heart rate, which is 71, and I always want to train to go down between 5 and 10 beats per minute. So 71, we're going to want to go to 66 to 61 beats per minute. That would be a very healthy heart rate, a healthier heart rate for Willie. Okay? And we can do it with exercise, we can do it with heart rate variability, right? But exercise would be helpful, okay? Now we have the EMG. The ideal value for EMG, any muscle group, resting again, is going to be, in the literature, is about 2 to 3 microvolts. Okay, so the muscle is very relaxed. 2 to 3 microvolts resting EMG for any muscle group. However, for a lot of people, it's very unrealistic to get to 2 to 3. It's very low. So I go, my personal opinion, and this is anecdotal, it's 5. So I go to a value of 5. And a value of 5 it's good enough. Now, if people go below 5 microvolts, excellent. But 5 is an acceptable value, okay? So that's for any EMG group. Shoulders, neck, the legs, the head, any, masseters, frontalis, any muscle group. Now your temperature and your GSR are very important. Your temperature and your GSR are the 2 best values to determine psychological vulnerability to stress. Okay? They are the 2 best variables to measure psychological vulnerability to stress. Okay? So your temperature and your GSR will tell you how vulnerable somebody is to stress. Okay? There's psychological vulnerability to stress. So how easy it is for a client to mentally succumb to the effects of stress. Temperature is related to trauma in that if it's low, very low, it could be related to dissociation. So clients with very low temperature, they can dissociate. But if you have low temperature, you need to check for medical things, such as thyroid, Raynaud's disease, or hypertension, or hypotension, because those things lower the temperature. It also correlates with constriction. So if the client is suppressing emotions, they have low skin temperature. Okay. Now the ideal value is about 30, between 31 and 33. That's acceptable for males and females. If you can go higher, close to 36, 37 Celsius, that's even better. Okay. Now remember, this is not the core temperature. This is the peripheral temperature. So this is not the type of temperature your doctor measures when you're sick, or when they want to check. It's blood flow to the periphery, the arms and hands. Okay, the arms and the legs, sorry. But 31, 33. Now, for women, changes according to the menstrual period and hormones. So menstruation in women will affect that. So sometimes you need to ask the question to female clients. It's a little too intimate, but you need to ask them if they're menstruating or not, because that can change the values. If the client is sick with the flu, the cold, or any kind of virus, temperature will go up and down if they're running a fever. So when you do the assessment, the client needs to be completely healthy. If they have a flu, send them home, have them come back later. Same for a qEEG, or same for any kind of assessment. Okay. Now, GSR correlates with gastrointestinal disorders. So people with really high GSR can have IBS, irritable bowel syndrome, gastritis, acid reflux. Those things can be correlated to that. So normally when I have clients with really high GSR values, they have some kind of gastrointestinal condition. So for stress and gastrointestinal disorders, GSR is a good choice. Now the tricky thing with the temperature and GSR is that they only have sympathetic innervations. So they don't respond to parasympathetic activation. If you want to increase the temperature and you want to decrease the galvanic skin response, you have to deactivate the sympathetic branch. Because no matter how much you activate the parasympathetic branch, if you don't deactivate the sympathetic branch, you're not going to get anywhere. So these two are a good correlate of how psychological stresses affect physiological response. All right, and temperature values 31, 32, and for GSR I go with 2.5 and below, sometimes 3 or lower. So 2.5 or 3 or lower. That's an acceptable value. Anything over 3, we have to pay attention to. All right. So respiration rate again, 5 to 7 breaths per minute, resting. Heart rate, depending on the client, but we want to go 5 to 10 heartbeats below the resting heart rate. And exercising and heart rate variability will help us do that. EMG, 5 microvolts or less for any muscle group, resting. Again, not doing movement, not walking, just resting. Temperature, 31, 33, as close to 36 as we can get. Celsius, and the GSR 2.5 or 3 microsiemens or below. So those are the measure units. Okay. So with that in mind, we take a look at this and we set up the intervention for the client. So we're gonna look at face to face, right? We're gonna go face by face. So we're gonna start with the baseline. Again, we locate the cursor here, left click and hold. And we drag it and let go. Segment compute statistics. So we have a respiration rate of 16.24. Is that high? Is that low? According to the values that I gave you, which is 5 to 7, are we above what we need? Are we where we need? Are we below where we need? So what do you think? Is that high or is that low? It's high, yes. Because remember, the ideal value for him resting is 5 to 7. Okay, so 16 is gonna activate sympathetic tone. So the tendency for Willie to be stressed out is gonna be higher because he's breathing a lot higher. Okay, 72.43 for the baseline. Again, that's not bad for his age; it's normal, but we can make it healthier. So the fact that it's okay does not mean that we cannot improve upon it. We do improve upon it, right? We can make it lower. 5.3 for the shoulders, 3.68 for the neck. That's good. We're within the values, right? Remember, EMG, 5 microvolts or less for any muscle group. Temperature 72 Fahrenheit, which is about 20 something Celsius, 28, 29 Celsius. So it's a little low. And when I was prepping him, I was holding his hand and it was cold. So you can tell by just shaking the client's hands or doing the prep that the hands are a little cold. So we can increase the temperature for Willie and that will help him relax. And since he's an athlete, low temperature will correlate with more anxiety during the games. Right? Is that something that happens? When you get anxious, your performance goes down? So the mechanics of the throw get affected, right? And the GSR is 6.545. That's high. Now, GSR also correlates with mental rumination, cognitive rumination. Is that something that happens to you? Thinking about, if you make a mistake during the game, do you think about it over and over sometimes?
Yeah.
So it correlates with rumination, an active anterior cingulate cortex. All right. So this can help bring rumination down, fretting and anxiety, give more cognitive flexibility too. So we have those values. Now we're gonna go on to the stress one phase. And what do we expect the values to go up, right? How high are they gonna go? Well, we don't know. So we'll see. So again, drag, and there we go. So respiration went up to 19, which is expected. And why is it expected? Because he's talking. If I'm sitting and I'm breathing, because I'm training my breathing, well, of course it's going to go down. If I'm talking, my breathing is going to go up. So we expect it to go up, okay? It went up 3 cycles per second, per minute, sorry. So it's not too bad. Again, he was good with the math. He got there very quickly. So people who are not good at math, who hate math, are going to do a lot poorer. So the respiration is going to go up to 23, 25, 27 breaths per minute. Because it's natural. It stresses them out, right? So if you have somebody like Willie, next time we'll do another type of test. That stresses him a little more. But look, the shoulders went to 9. From 5 to 9. So we have some tension there, right? So the math stressed him a little bit. Even though he was doing well, he got stressed a little bit. Now, it could be a sign of activation. His body's getting ready for it. And 9 is not too critical. I mean, you know, we'll see in the post if he goes down. But if he goes up to 20, 30, 10, or 15, or something like that, then we go, ooh, we need to take a look at that. 4.87 for the neck, which is good. So most people will have reaction on the shoulders. They will have the tension here, and they will relax the neck more. But we'll see as time goes by, as time progresses, we'll see if that's the case. 72 something the temperature, and I want to bring your attention to that. Let me drag the window down here. So if you see the temperature went down a little bit, see that? So there was a drop in the temperature, which means there's stress. What happens when we're stressed out? We secrete adrenaline. Okay? Our blood vessels have receptors for a chemical called alpha receptors. Right? So what happens is the adrenaline can bind to that alpha receptor and cause vasoconstriction. So whenever you're stressed out, when you're secreting adrenaline, your adrenaline will bind to the receptor and will cause the blood vessel to close up. Vasoconstriction. All right? So that's why the temperature goes down. Alpha adrenergic receptor. If you're relaxed, you're producing more BDNF, which is another chemical that causes the vessels to dilate. So vasodilation is more relaxation because you have less cortisol and less adrenaline. So temperature went down a little bit, and from 647 to 643, there was not a lot of change. So the math didn't stress you too much, but it didn't relax you either. So you remained somewhere over there. So it's in spite of the stress, you did well. You were doing well with the numbers. It was not until I started pushing you that you started feeling a little more stressed, because I said faster, 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 right? So what went up? The respiration and the EMG, right? Temperature went down. So here's where we start paying attention to things. Oh, muscles went up, so it might be something we might want to train when he's stressed out. Because at the catcher, you have to throw it back to the pitcher. Or if somebody's stealing second base, you have to throw it to second base, right? Yeah. So think about it. The movement is something like this. And if the shoulders are tense, what is going to happen to the throw? The mechanics are going to go to hell, you know. So his mechanics are going to be affected. So if he has a runner stealing second base and he throws, he's either going to overthrow it, or the throw is going to be too short. So his performance is going to be affected by it. If he's over breathing, his focus is going to go out of the window too. It's going to go out the window. So we start, you know, as an athlete that he is, we start looking at the bigger picture and putting things together. That make sense? Okay. So then we're going to go with the recovery. So what was the instruction that anybody remembers what was the instruction that I gave him after he finished the math? I told him, relax as much as you can. And you want to deliberately give them that instruction because you want to see how fast and how well. You want to see how fast and how well the client recovers, okay? So he went from 16 to 19 to 13, so he recovered. He was breathing a little slower, still high, because remember, we went 5 to 7, right? So still a little high. Now his heart rate went down to 65. Interesting. So that was a good recovery. So what would that tell you as clinicians? If you're the professional working with Willie, what would that tell you? What would the fact that he went from 16 breaths per minute to 19 breaths per minute to 13 breaths per minute, from 72 to 72 to 65 beats per minute, what would that tell you? What would you imply from that? What would you think about Willie if that's the case? He was stressed and then he went down. So what would that mean? Well, it would mean that he has the ability to recover. What do we need to do? We need to train it. So because he recovered nicely, it tells me that he has the innate ability. He just needs to, we need to shape it and train it. That's what we need to do. His muscles from 9 went down to 8, so there was not there was a little bit of a recovery, but not too much. So again, we pay attention to the muscles, right? So that's something we might need to pay attention, especially with him as a catcher, depending on the muscles of the back and the arm for the throw. And it could be overused too, because they have to. I mean, how many balls do you throw in your life as a catcher? Thousands of them. So the muscles get overused too. You know, you get shoulder injuries and back injuries too. And he's in a special position where when you have the player running, rounding third base, and he's got the ball, the player is allowed to jam him, to ram him. So it's a very violent collision. So, you know, it's a place for injury too. So that could be injury, it could be overuse, it could be overtraining. So we need to look at all those things. Okay. 72 for the temperature. It went up a little bit, and I'm gonna go drive the window down again. So if you notice, you had a slight recovery. Temperature is a little low. We need to bring it to 80 something, 90 something Fahrenheit, which is the equivalent of Celsius. Okay. But look at the GSR. It went up to 529. He recovered nicely. So again, he recovered with breathing, he recovered with the heart rate, and he recovered with the GSR, which tells me he's trainable. He's highly trainable. Well, everybody's trainable, but he's highly trainable. And because he's an athlete, he might have a natural innate ability to recover, which is even better, right? So that's good. Now, we're going to stress him again, and this time we're stressing with the client assessments, which is something he clearly hates. So we're going to see how stressed he gets, right? So look at that. The respiration rate went up to 22. So this is something that Willie doesn't really like to do. And we all have, in our jobs, we all have something that we hate. And clearly this is it for him. We have a 76 for heart rate, went up again. So that's significant. It's not something to get too scared about, but it's significant. The muscles 6 and 5 here. The temperature went down again, and the GSR went up again. So here's two sides of the coin, all right? Two sides of the sword to the story. He can relax, but he can get stressed too. So Will is good at relaxing, but he's also good at stressing out. So what do we need to do? We need to get him better at what? Controlling the stress. Spending more time in relaxation, being more resilient to the psychological stress. Okay? Because as a baseball player, this will hinder his performance greatly. And the muscle thing makes him more prone to injury. Makes him more susceptible to an injury. Okay? Because, I mean, after all, baseball is it wears out the body. And let's look at the last recovery phase. So let's see how he did again. So, here we go. So he went down to 15 breaths per minute. That's his average. Unless we train it, it's not going to go down. You know, it's not going to go down because we wish it would, or magically. It needs to be trained for it to go down. 66 the heart rate, he recovered pretty well. So it means that he can drop to 60 something beats per minute. Even if you exercise because you're young still, it might go even lower. Okay. 5 and 4. So those are good. If we can bring it a little lower, it's better because of his sport and his sporting activity. If you get more relaxed muscles, your throws are going to improve, which is always good. 71, the temperature went down and stayed down. See that? So temperature is something we need to look at. So if Willie were my client, I would refer him to the doctor just to make sure the thyroid is okay, his tension is fine, that there's no circulatory conditions going on. You know, we just want to make sure that it's not only the stress, because it could be medical, and we want to cover our end. And if we find something medical, it's going to be even better because we have some more integrated work to do. And then his GSR went down to 15, which is nice. He recovered. So he can stress, yes, but he can recover, yes. Which means that if we help Willie hone that skill and stay there more and drop his values lower, he's going to benefit more. Both at the athletic level and then at the personal level too. So it's going to make him a better student and a better, better professional, better athlete. So that he's gonna be reaping the benefits in every area of his life, which is good. All right. So is that clear? Is that good?
Hi, Santiago. I have a question.
Yes.
It's still a recovery phase 2.
Yeah.
So do you think we need to do some artifact rejection?
We could do. Yeah, that's a good question. What Chen's asking here is about this line here, and that's probably he moved the finger a little bit. That's an artifact. So we can remove that certainly, and we'll change the value. And the way you do it is very simple. You go to that and just left to right click, and you go add artifact area. Oh, you gotta lock it first. Okay. We gotta unlock it, and I'll do that in a second. But what you do is you select that, and it takes it out of the equation. So yeah, that's a little bit of an artifact. I wouldn't worry about it too much because it's just one, it's a 2-minute take. But if you're doing research, yes, you need to take that away.
So do we need to do the automatic rejection?
You could, yeah. You could set up an automatic rejection, which the software rejects, identifies the artifacts based on an algorithm, and it takes them away. Or you can do the manual. If you're doing long recordings and repeated recordings, then the automatic one is good.
How to set the threshold, the cutoff point of the rejection?
Oh, that's one. We can see that when we do that. Right. Now, the other thing you can do is remember you can tape the sensors so you minimize movement of the cable. And he was sitting on a chair that is not too comfortable. If you have the reclining chair, you're gonna have the arms to the sides, so you minimize those things. But it's a good question because you want to take all those things into account. Because if you're doing research, that is going to be important. For this demo, and if you were my client, I wouldn't worry too much about it in the clinical setting, but in the lab, yes, that's something you might want to consider. Any other questions? All right, so we're going to break into groups, please. And let's try to break into equal groups, and we'll set you up with an amplifier so we can start doing the stress profile. So try to do at least one stress profile. So everybody put the sensors, do the recording, save the session, right? And if you have any questions, please ask me, okay? And then we're gonna remain in the groups, and we're gonna jump into the neurofeedback then because you're in the group. So I'm gonna show you how to set up the thresholds and all those things, which is what you were asking, all right? All right, so let's get set up, please. Equal groups, and then we'll help you out.
电脑的话，电脑是只有这边一台跟我自己电脑一台2台，然后我再加他的电脑3台。对，
就分3组。
好啊。
Okay. Oh yeah. If one group wants to use my computer, you can go ahead and do that. And we have 2 more. So let's. How many of us are there? No. How many people total? Okay. So let's do groups. Let's do groups of 6, 5 or 6. So you guys. So one group can come here because this is ready. So you wanna? Okay, and we'll have another group, another 2 groups here. Alright, so you guys go ahead. Feel free to start. We need 3 more people here who wants to come to this group. You guys can get going, and if somebody joins you, that's fine. And then we'll have 2 groups here. So we need to make 2 chairs. Alright, so who wants to be the client? Okay, great. And the way I would recommend is that each one of you places a different sensor. So one of you can do the respiration, one of you can do the energy, one of you can do the GSR. So you, and then you feed back to each other, provide feedback to each other. Alright, so we need a group of 5 or 6 over here. So one wants to come here. And then another group on this side here. But remember, somebody's got to put it up there.